Sir, this isn't the free clinic. You need to leave before we call the police. The words cut through the emergency department, like a scalpel through flesh. Nurse Kimberly Walsh didn't even look up from her computer screen when she said it. Her voice carried the casual dismissiveness of someone who'd made this judgment 1,000 times before. Dr. Isaiah Bennett stood perfectly still at the triage desk, one hand pressed against his left temple, where a sharp stabbing pain had been building for the past 20 minutes. His other hand held his phone, the screen still showing the last text message he'd sent to his wife. Severe headache. Going to ER. Don't worry. The irony wasn't lost on him. This was Memorial Grace Hospital, the hospital he'd helped found 12 years ago. The hospital where his name was literally engraved on a bronze plaque in the main lobby. Dr. Isaiah Bennett, chief of neurosurgery, founding board member. But right now, standing in the ER, wearing jeans and a Stanford hoodie instead of his usual white coat and ID badge, he was just another suspicious black man. Have you ever been invisible, in a place where everyone should know your name? Ma'am, Isaiah said quietly, his voice steady despite the pain lancing through his skull. I need to see a doctor. I'm experiencing severe neurological symptoms. Yeah, I bet you are. Kimberly finally glanced up, her eyes sweeping over him with practiced skepticism. Let me guess. Back pain? Migraines? Need some pain medication? Her tone dripped with accusation. We don't just hand out prescriptions here, sir. Isaiah's jaw tightened. The headache was getting worse. Much worse. As a neurosurgeon with 23 years of experience, he recognized the symptoms. Sudden onset. Severe intensity. Left-sided presentation. This wasn't a normal headache. This could be an aneurysm, a stroke, or worse. I'm not asking for medication, he replied, keeping his voice level. I'm asking for a neurological assessment. My symptoms began approximately 27 minutes ago. Sir, Kimberly's voice took on an edge. This is a busy emergency room. We have real patients with real emergencies. If you're looking for drugs, there's a clinic downtown that might help you. A security guard appeared at Isaiah's peripheral vision. Officer Marcus Thompson, a man Isaiah had personally greeted during the hospital's staff appreciation dinner just 3 weeks ago. But Thompson wasn't wearing his reading glasses today, and Isaiah wasn't wearing his white coat. Recognition was a one-way street. Is there a problem here, Kim? Thompson asked, his hand moving casually toward his radio. This gentleman is refusing to leave, Kimberly said, her tone suggesting Isaiah had been causing a scene for hours instead of standing quietly in pain for less than 2 minutes. What happens when the people meant to help you see you as a threat? Isaiah's phone buzzed. A message from Dr. Sarah Chen, his chief resident. Dr. Bennett, Mr. Rodriguez's post-op scans look concerning. Need your assessment ASAP. Another text, this time from his surgical scheduler. Dr. Bennett, board meeting in 45 minutes. Confirming your attendance? The board meeting, where he was supposed to present the new anti-discrimination training protocol he'd been developing for the past 6 months. The protocol designed specifically to prevent situations exactly like the one he was currently experiencing. The pain in his head spiked sharply. Isaiah's vision blurred for a moment. He gripped the edge of the triage desk to steady himself. Sir, step away from the desk, Thompson commanded, interpreting Isaiah's movement as aggression rather than distress. I'm experiencing potential stroke symptoms, Isaiah said, his medical training overriding his frustration. Sudden severe headache, visual disturbances, left-sided weakness. Right. Kimberly rolled her eyes. You just happened to Google stroke symptoms on your way here? She turned to Thompson. Call Metro PD. We've got another drug seeker getting aggressive. But here's what they didn't know. Isaiah's phone buzzed again. This time, a video call from Dr. Jennifer Martinez, the hospital's chief medical officer, his direct report, his colleague, his friend. He declined the call, not because he wanted to, but because answering it would reveal who he was. And something deep in his surgical training, the part that had learned to observe, document, and analyze before acting, told him to wait, to see how far this would go, to document everything. Sir, I'm going to ask you one more time to leave voluntarily. Thompson's voice had shifted from casual to official. His body language had changed too. Shoulders back, feet planted, hand near his pepper spray. Isaiah had seen this transformation before, not in his own experience, but in the stories his residents told him. The young black medical students who got stopped in the parking garage despite their hospital ID badges. The attending physicians questioned in the hallways by visitors who assumed they were janitors. He'd always listened with sympathy. He'd always promised to address it systematically. Now he was living it. "Officer Thompson," Isaiah said clearly, enunciating each word. "I am a patient experiencing a medical emergency. I am requesting treatment for potential stroke symptoms. This hospital has protocols for stroke assessments that should have been initiated within 10 minutes of my arrival." It was a gamble. Using formal medical language, demonstrating knowledge of protocols. It could work in his favor, or it could make them more suspicious. Kimberly's eyes narrowed. "How do you know our stroke protocols?" "And that's when everything started to unravel, because I wrote them," Isaiah said quietly. But the pain in his head chose that exact moment to spike again, and his words came out slurred. "I wrote the protocols," slurred speech, a classic stroke symptom. But to Kimberly and Thompson, it sounded like intoxication. "That's it." Thompson grabbed his radio. "This is security. Need backup in the main ER. Intoxicated patient becoming aggressive and delusional." "I'm not intoxicated," Isaiah protested. But his vision was swimming now. The fluorescent lights above seemed to pulse and blur. "I'm Dr. Isaiah Bennett, Chief of Neurosurgery. I need a CT scan." His legs buckled. Thompson caught him, but not gently. "Sir, you need to calm down. You're going to hurt yourself." Through the haze of pain, Isaiah heard Kimberly on the phone. "Yeah, we've got a situation. Black male, approximately 40 years old, claiming to be a doctor, obviously intoxicated or high, becoming aggressive." The ER doors slid open. 2 more security guards entered, followed by Dr. Sarah Chen stopped dead in her tracks. Her face went from routine concern to absolute horror in less than a second. "Dr. Bennett?" Her voice cut through the chaos like a surgical laser. "Oh my God. Dr. Bennett." Everything froze. Kimberly's hand stopped mid-dial. Thompson's grip on Isaiah's arm loosened. The 2 backup security guards looked at each other in confusion. Sarah rushed forward, her residence badge swinging against her chest, the same badge that identified her as working under Dr. Isaiah Bennett's supervision. "What are you doing?" Sarah's voice shook with fury and fear. "This is Dr. Bennett, Chief of Neurosurgery. Why isn't he being treated?" Thompson stepped back immediately, his hands up. We didn't. He wasn't wearing a badge. He's having a stroke." Sarah was already pulling out her penlight, checking Isaiah's pupils. "How long has he been standing here? How long?" Kimberly had gone completely pale. He didn't say he told you he needed neurological assessment." Sarah's voice rose. "Code stroke, now." But the damage was already done. The next 60 seconds moved with the choreographed precision that Memorial Grace was famous for. Within moments, Isaiah was on a gurney. Stroke team assembled, CT scanner warming up. The entire machinery of emergency medicine that should have activated 27 minutes ago was now running at full speed. But Isaiah's eyes, despite the pain, despite the medical crisis, remained focused, watching, documenting, recording. Dr. Martinez appeared, her face a mask of professional control, barely concealing personal horror. "Dr. Bennett, we're taking you to CT now. Try not to move." "Time," Isaiah managed to say. "Document the time." Martinez understood immediately. "Sarah, exact timeline. From his arrival to treatment initiation. Everything." As they wheeled Isaiah down the corridor toward imaging, he saw them. The staff members lining the hallways, the nurses who'd worked under his supervision for years, the residents he'd trained, the attending physicians he'd mentored, all of them looking at him with the same expression. "This could have been me." The CT scan revealed a small vascular anomaly. Not an aneurysm, thank God, but serious enough to require monitoring. Serious enough to have warranted immediate attention. Serious enough that a 27-minute delay could have been catastrophic. In the recovery bay, Isaiah lay still, letting the medication work, letting his blood pressure stabilize. But his mind was already working, already processing what had happened. Dr. Martinez stood beside his bed, her professional composure finally cracking. Isaiah, I am so sorry. This should never have happened. Never. No, Isaiah said quietly. It shouldn't have, but it did. And now we're going to make sure it never happens again. His phone buzzed. Messages were flooding in. Word had spread through the hospital faster than any virus. The chief of surgery denied treatment in his own ER. The board meeting was in 20 minutes. Isaiah was supposed to present his anti-discrimination training protocol. Jennifer, he said to Martinez, I need you to do something for me. Anything. Get me Kimberly Walsh and Marcus Thompson. Not to punish them, to educate them. Martinez blinked in surprise. You want to talk to them? After what they— This isn't about revenge, Isaiah interrupted. This is about fixing a broken system, and I need them to understand what went wrong. Not because I say so, but because they experience the consequences firsthand. Because quiet power isn't about destroying people. It's about transforming systems. 15 minutes later, Kimberly and Marcus stood at the foot of Isaiah's bed. Both had been crying. Both looked like they wanted the earth to swallow them whole. Dr. Bennett, Kimberly's voice broke. I don't even know what to say. I'm so sorry. I'm so sorry. Thompson couldn't even speak. He just stood there, his security uniform suddenly seeming like a costume he didn't deserve to wear. Isaiah looked at them. Really looked at them. Not with anger, not with judgment, but with the same clinical assessment he'd used to evaluate a surgical complication. Tell me, he said quietly. What did you see when I walked up to that desk? Kimberly swallowed hard. I saw— Be honest. I saw a black man in casual clothes. No ID badge. No insurance card visible. And I assumed— She couldn't finish the sentence. You assumed I was drug-seeking, Isaiah completed for her. You assumed I was lying about my symptoms. You assumed I was a threat. Kimberly nodded, tears streaming down her face. Officer Thompson. Isaiah turned to the security guard. When I said I was experiencing stroke symptoms, what did you hear? Thompson's voice was barely a whisper. I heard excuses. I heard someone trying to manipulate the system. Why? The question hung in the air like a surgical instrument, precise and sharp. Because— Thompson struggled. Because I've seen it before. Drug seekers who know medical terminology, who fake symptoms. And I assumed— You assumed, Isaiah said. Based on what? My symptoms were textbook stroke presentation. Sudden onset, severe headache, visual disturbances, weakness, slurred speech. Everything I told you was medically accurate. So what made you dismiss it? The silence was devastating. My skin color, Isaiah said, not with anger, just with clinical accuracy. That's what made you assume, not my symptoms, not my words, my appearance. And that's when the real transformation began. I could fire you both right now, Isaiah continued. I have that authority. I have the justification. And honestly, part of me wants to. Because what you did wasn't just discrimination. It was potentially lethal. If I had been having a major stroke, that 27-minute delay could have cost me my life. Both of them were sobbing openly now. But firing you doesn't fix the system, Isaiah said. It just removes 2 symptoms while the disease continues. So here's what's going to happen instead. He pulled out his tablet, opening the presentation he was supposed to give at the board meeting. This is the anti-discrimination training protocol I've been developing. You two are going to be my first test cases. For the next 6 months, you're going to work directly with me. You're going to attend every diversity training session. You're going to shadow minority patients through the ER process. You're going to document every interaction. And most importantly, he locked eyes with both of them. You're going to help me build a better system because you've experienced firsthand how the current system fails, and that makes you uniquely qualified to help fix it. Kimberly looked up, hope and disbelief warring on her face. You're not firing us? I'm transforming you, Isaiah corrected, from part of the problem into part of the solution. But understand this. If you don't commit fully to this process, if you don't genuinely change, then yes, your employment will be terminated. This is your one opportunity to make this right. Thompson wiped his eyes. Dr. Bennett, I don't deserve this chance. I don't deserve your forgiveness. This isn't about forgiveness, Isaiah replied. This is about effectiveness. Firing you would make me feel better for about 10 minutes. Training you might save lives for the next 30 years. Which option creates more value? The board meeting started 15 minutes late. Isaiah walked into the conference room with Dr. Martinez beside him. The entire board of directors stood immediately, their faces reflecting shock and concern. Isaiah, we heard what happened, Board Chairman Robert Williams said. Are you all right? Should you even be here? I'm fine, Isaiah replied, setting up his presentation. And yes, I should definitely be here, because what happened to me this afternoon is exactly why we need this protocol. He clicked to the first slide. The Bennett Protocol, Systematic Discrimination Prevention in Healthcare Settings. What you're about to see isn't theoretical anymore, Isaiah began. As of 2 hours ago, it's personal. As of 2 hours ago, it's documented. And as of right now, it's mandatory. The next slide showed the timeline, 11:43 a.m. Dr. Bennett arrives at ER with acute neurological symptoms, 11:44 a.m. Initial assessment denied based on appearance, 11:47 a.m. Patient, Dr. Bennett, explicitly describes stroke symptoms, 11:48 a.m. Medical assessment denied. Police called instead. To Hellival. Patient's identity revealed by colleague, 12:10 p.m. Treatment finally initiated, 27 minutes. Total delay in emergency care. The room was dead silent. 27 minutes, Isaiah said. That's how long it took for me to receive treatment for potential stroke symptoms in my own hospital. Not because the staff was incompetent, not because the facility lacked resources, but because I didn't look like their expectation of what a patient or a doctor should look like. He clicked to the next slide. Statistical data. According to our own hospital data, Black patients wait an average of 23% longer for pain medication compared to white patients with identical conditions. Hispanic patients are 31% more likely to have their symptoms dismissed as non-urgent. Asian patients report higher rates of being treated as difficult when advocating for their care. Board member Dr. Patricia Collins raised her hand. Isaiah, I had no idea our disparities were this severe. That's because we weren't measuring them systematically, Isaiah replied. We were treating symptoms instead of diagnosing the disease. Today, I'm proposing we change that. The next 45 minutes detailed the most comprehensive anti-discrimination protocol ever implemented in a private hospital. Mandatory implicit bias training. All staff, from janitors to surgeons, quarterly refresher courses, scenario-based learning using real cases, including today's incident. 2. Real-time monitoring system. Track patient wait times by demographic. Algorithm alerts for statistical anomaly. Monthly review by diversity committee. 3. Patient advocacy program. Dedicated liaisons for minority patients. Multilingual support. Cultural competency specialist. 4. Accountability measure. Performance reviews tied to bias metrics. Financial incentives for departments showing improvement. Transparent reporting to community stakeholder. 5. The Bennett Documentation Protocol, named after today's incident. Immediate escalation pathway for discrimination concerns. Protected reporting for staff who witness bias. This won't be optional, Isaiah concluded. And it won't be temporary. This becomes part of our hospital's DNA, starting today. Chairman Williams spoke carefully. Isaiah, this is ambitious. Some might even say extreme. The cost alone, the cost of not doing this, Isaiah interrupted, is measured in lives. Today it was me. Tomorrow it could be someone without my credentials, without my resources, without my ability to advocate for themselves. Someone who dies because they were judged before they were treated. He clicked to his final slide. A single question. How many patients have we already lost to bias we didn't measure? The vote was unanimous. 6 months later, the transformation was measurable and profound. Memorial Grace Hospital's patient satisfaction scores among minority communities had increased by 47%. Wait time disparities had dropped to less than 3%. The hospital had become a national model for implementing anti-discrimination protocols in healthcare. But the real change was in the stories. Kimberly Walsh now ran the hospital's patient advocacy training program. Her first-person account of the day I denied my own chief of surgery treatment had become required viewing for all new hires. She'd discovered a passion for cultural competency training she never knew she had. Marcus Thompson had earned his EMT certification and was now working in the ER as a patient care technician. He'd requested the transfer himself, saying he wanted to help people instead of just watching over them. His unique perspective as both security and healthcare provider made him invaluable in de-escalating tense situations. Dr. Sarah Chen had published a case study in the New England Journal of Medicine. When implicit bias delays emergency care, a chief of surgery's experience. The paper had been downloaded over 100,000 times and cited in 18 separate healthcare policy reforms across the country. The Bennett Protocol had been adopted by 47 hospitals nationwide, with another 100 in the implementation phase. But Isaiah's proudest moment came on a Tuesday afternoon. 6 months and 3 days after his ER incident, an elderly black woman arrived at the ER with chest pain. She wore housekeeping clothes from the hotel down the street. She didn't have insurance. She spoke with a thick accent. Within 90 seconds, she was on a cardiac monitoring system. Within 4 minutes, the cardiology team was assembled. Within 12 minutes, she was in the cath lab, receiving life-saving intervention for a massive heart attack. The nurse who'd initiated the rapid response? Kimberly Walsh, the security officer who'd helped transfer her quickly to the cath lab. Marcus Thompson. They found Isaiah in the surgical wing later that afternoon, both of them in tears. "She made it," Kimberly said. "Mrs. Johnson, she's going to be okay." "Because you didn't wait," Isaiah replied. "Because you didn't assume. Because you treated her symptoms instead of her appearance." Thompson pulled out his phone. "Dr. Bennett, I want to show you something." It was a video. Security camera footage from the ER entrance. Time-stamped 3 months ago. The footage showed a young black man arriving with what looked like a panic attack. The old Thompson would have seen a threat. The new Thompson saw a patient. Within minutes, the young man was getting treatment for a previously undiagnosed heart condition that was causing the panic-like symptoms. "We saved his life," Thompson said quietly, "because you saved ours." The real story isn't about one day in the ER. It's about what happens when institutions choose transformation over punishment, when power is used not to destroy, but to rebuild, when one person's experience becomes a catalyst for systematic change that saves hundreds of lives. Isaiah Bennett could have fired everyone involved, could have sued the hospital, could have made headlines and destroyed careers. Instead, he did something more powerful. He built a protocol. He created a system. He transformed enemies into allies and bias into awareness. 6 months after that terrible day in the ER, Memorial Grace Hospital had reduced racial disparity in pain medication administration by 89%, decreased minority patient wait times to statistical parity, increased minority patient satisfaction scores by 47 points, trained 1,247 healthcare workers in anti-bias protocols, saved an estimated 23 lives through faster, more equitable emergency response. The Bennett Protocol was working, not just in theory, but in measurable, documented, life-saving reality. Want to know the most powerful part? Isaiah kept the video. All of it. His arrival, the dismissal, the escalation, the intervention, the aftermath. And he used it, not to shame, not to punish, but to teach. Every new employee at Memorial Grace Hospital watches that video, watches their chief of neurosurgery being denied treatment, watches the assumptions, watches the consequences, watches the transformation. This is how bias works, Isaiah tells them in the training sessions he now leads personally. Not with hoods and crosses, not with obvious hatred, but with assumptions so subtle we don't even realize we're making them. He pauses the video at the moment when he's explaining his stroke symptoms. Listen to my words, he tells the trainees. Every single thing I said was medically accurate. Textbook stroke presentation. But they didn't hear medical accuracy. They heard what they expected to hear from someone who looked like me. The training isn't comfortable. It's not meant to be. But it works. 3 years later, Dr. Isaiah Bennett stood at the podium of the American Medical Association's annual conference. The auditorium held 3,000 physicians from across the country. The question I'm asked most often, he began, is whether I regret what happened that day in my own ER. He paused, letting the question hang in the air. I don't. Because that day gave me something more valuable than my pride. It gave me proof. The screen behind him lit up with data. In the 3 years since implementing the Bennett protocol, we've documented a 94% reduction in bias-related care delays. We've saved an estimated 67 lives that statistical modeling suggests would have been lost under our previous system. We've trained over 4,000 healthcare workers. And most importantly, we've changed the conversation. He clicked to the next slide. A map of the United States, with dots representing hospitals that had adopted the protocol. 147 hospitals across 38 states are now using some version of the Bennett protocol. The Veterans Health Administration has made it mandatory. 3 state legislatures are considering bills to require it in all licensed healthcare facilities. Isaiah looked out at the audience. That day in the ER, I had a choice. I could have fought back with lawsuits and public shaming. I could have destroyed careers and made headlines. And for about 10 minutes, I would have felt vindicated. He paused. Instead, I chose transformation. I chose to turn my humiliation into education, my anger into action, my experience into evidence. The screen changed to show photos. Kimberly Walsh, teaching a cultural competency class. Marcus Thompson, helping an elderly patient. Sarah Chen, presenting research at a conference. Dozens of healthcare workers who'd been transformed by the protocol. These people aren't villains, Isaiah said. They're victims of a system that taught them the wrong things. A system that rewarded assumptions over assessment. A system that valued efficiency over equity. He clicked to his final slide. The Bennett protocol isn't about punishing bias. It's about preventing it. Because the goal, Isaiah concluded, isn't to catch people being racist. The goal is to build a system where bias can't survive, where every patient, regardless of their appearance, receives the same standard of care, where the color of your skin doesn't determine the speed of your treatment. The standing ovation lasted 4 minutes, but Isaiah wasn't thinking about applause. He was thinking about Mrs. Johnson, the elderly housekeeper whose life had been saved because Kimberly Walsh had learned to see patients instead of assumptions. He was thinking about the young man whose heart condition was caught because Marcus Thompson had learned to help instead of judge. He was thinking about the hundreds of lives saved by a protocol born from his worst day. This is what quiet power looks like. Not revenge, not destruction, but transformation. Not a moment of vindication, but years of systematic change. Not headlines that fade in a week, but protocols that save lives for decades. Isaiah Bennett walked into that ER as a patient, being discriminated against. He walked out as the architect of the most successful anti-bias initiative in modern healthcare. The revolution wasn't televised. It was documented, measured, and replicated. Your turn. Have you witnessed bias in healthcare? Have you experienced the subtle sting of being judged before being helped? Share your story in the comments. Let others know they're not alone, because every story matters. Every experience counts. Every voice can drive change. Hit subscribe our channel for more untold narratives of quiet power, strategic transformation, and systemic justice. Share this video. Let medical professionals see what bias looks like from the patient's perspective. Let hospitals know that change is possible, necessary, and measurable. Remember, you don't need to shout to be heard. You don't need to fight to win. You don't need revenge to create justice. You just need documentation, determination, and the courage to transform pain into progress. The Bennett Protocol started with one man's humiliation. It became a healthcare revolution. What will your story become?